Greetings to all. On this occasion of International Women's Day, I want to brief all of you about a very important disease affecting the women across the globe, that is breast cancer. Breast cancer is one of the most common cancers affecting women across the globe, and the incidence and prevalence is significantly increasing in the Asian population. The most worrying aspect of this is that the Asian women, particularly the Indian women, are affected a little earlier than their counterparts in the West. Also, the disease affecting the Indian women is also more aggressive, mainly because it is diagnosed relatively late in the disease course. On this occasion, I want to inform all the women out here that in spite of this grave scenario, it is still possible to have a curative treatment for this dreaded disease. Like most of the other cancers, early detection is one of the very important factors in combating this disease. When I talk about early detection, it has to be detected even before it is presented in the patient. For this, there are a few techniques. Number one is self breast examination. This is a technique of examining one's own breasts by the person, by the woman herself, and it has to be done systematically. The person needs to learn this technique by a doctor or a practicing nurse. Most of the early diagnosis happens when the breast self-examination detects small tumor in the breast. Apart from this, there are different screening tests for breast cancer. Most commonly used are mammography, I mean the digital mammography, and ultrasound of the breasts, also called sonomammography. Now, international recommendation for women is annual mammography with or without ultrasound after the age of 40 years. That is a recommendation for all women, irrespective of whether they have symptoms or not. Of course, if the woman develops some symptoms even before the age of 40, she has to come for a checkup. Of course, that's not called screening, it is a diagnostic work. Apart from mammography, we also have something called MRI. Generally, if a woman falls into the category of high risk for developing breast cancer, when I say high risk, the woman has got a first degree relative who's suffering from breast cancer, or a woman who has a BRCA1 and 2 mutation positivity, or a woman who had radiation therapy given to the chest for some other cancers, maybe earlier in her life. These are the women who fall into the category of high risk. In these women, the screening starts at the age of 25 years of age. That is, 25 years you start mammography with or without ultrasound and MRI for screening. With these techniques, it is possible to identify most of the very early cancers, and the moment we identify tumors in the breasts on imaging, we go for diagnostic tests, that is either biopsy or surgery. If it is biopsyable, that means the tumor is seen on imaging like either either ultrasound or mammography or MRI, and not palpable, then an image guided biopsy is recommended. Once the biopsy is performed, they will do further tests on the sample to identify what type of breast cancer it is. Then the staging happens, that is, once the cancer is diagnosed, we have to identify whether the tumor or the cancer is limited only to the breast or it is spread beyond the breast, like into the glands or into the lungs or in the bones, brain, liver, etc. So once this staging is done, appropriate therapy or appropriate treatment can be planned for the patient. However, higher the stage, poor is the outcome. And hence, the take home message is early detection, better results. For early detection, you have to go for self breast examination and annual mammography screening after the age of 40 years. Thank you.